Dr. Malan, we have received several emails from prospective patients who would like to know how your fat transfer is different from other physicians out there.
Well, there are a lot of different ways to do fat transfer, and especially when you're dealing with fat transfer to the breast where you're looking at large volumes of fat being transferred. This is a procedure that was started back in the 1980s but was banned for the last 20 years because we just didn't have the technology and we didn't have the understanding as to how to do the procedure safely and effectively to get good results and to not interfere with the mammogram. So the procedure was banned. Well, we've learned a lot in those last 20 years, and one of the reasons the ban has been lifted on the procedure is because of these new techniques. We now have the ability to harvest the fat, remove the fat without damaging it, without traumatizing the fat. We now have the ability to remove the fat and to get it ready for transfer without using a device called a centrifuge, which spins the fat. And when you spin the fat, you damage or break the fat up, which means less viable fat that's going to go into the breast and not as good a survival. We also understand how to transfer the fat into the breast into little tiny microjobullets so that we can improve the oxygen that surrounds the fat. If we inject the fat into one big glob into the muscle, it's not going to survive well. We have to layer the fat in little tiny droplets in the actual fat layers of the breast to really improve the survival. So we've learned a lot of valuable lessons over the last 20 years. Now, unfortunately, when the ban was lifted, based a lot on the information that we had learned from our own studies, it created some difficulties in that there are doctors out there that are using the exact same methods that caused the procedure to be banned 20 years ago, meaning that they're removing the fat and freezing the fat, injecting small amounts, freezing the rest of the fat, and then having the patient come back several months later to inject the frozen fat. Well, we know that freezing the fat kills it, and that if you freeze the fat, you're not going to get long-term survival. But that's a lesson that folks just didn't learn from their history. We also know, again, that centrifuging or spinning the fat doesn't work. We know that using old-fashioned liposuction techniques to harvest the fat tears the fat and damages the fat. So we've learned a lot of lessons, and now we're able to provide really good results and to get really good fat survival without causing problems that can interfere with the mammogram in the future.
Thank you, Dr. Malan.
Thank you.